Hello and welcome to Success in the NDIS Market, the first governance webinar in our NDIS Success Roadmap. Community Business Bureau acknowledges the traditional owners of country throughout Australia. We recognise their continuing connection to land, waters and community, and we pay our respects to them and their cultures and to elders past, present and emerging. Thank you for signing up for CBB's NDIS Success Programme. My name is Jane Arnott, and on behalf of the Business Consulting Team, I'd like to welcome you to our first NDIS Success Governance webinar. There are now almost 392,000 Australians benefiting from the NDIS. This includes over 175,000 people receiving disability supports for the first time. The NDIS will ultimately provide $22 billion in funding per year to an estimated 460,000 people with a disability. This will contribute to the creation of around 90,000 jobs in the disability sector across Australia. The NDIS Success Programme aims to support organisations and sole traders to plan for successful NDIS provision, either starting as a new service provider or growing your existing services. So we're running two webinar series. The management series is for leaders, managers and operational staff and sole traders, and it's to look at the fundamentals of the NDIS. It's to help you understand what it means to provide services under the NDIS. It also looks at the importance of understanding the market you want to operate in. So who are your potential customers, what do they need and want from their NDIS provider, and who else is already providing NDIS services in your area. We look at how to develop an NDIS service model, the compliance requirements, and how you go about your strategic and marketing planning. And finally, the webinar series looks at understanding and analysing your potential revenue and associated costs. Financial viability is clearly critical for your long-term sustainability in the NDIS. The management series is available to access via our website, so you can click on there to access the webinars. This governance series has two webinars, this session on success in the NDIS market and another webinar on strategy, risk and impact. The idea is to build board member understanding of the impacts and opportunities of the NDIS so that you can make more informed strategic decisions and provide effective support to organisations' leadership. Each of the webinars will be followed by a Q&A session to give you the opportunity to ask questions, and we encourage you to submit questions at any time prior to the Q&A via the Facebook group or via email. So today's session, Success in the NDIS, is aimed to give you an understanding of the NDIS and look at the governance environment. So we'll cover the history of the NDIS, we'll talk about who gets access and what gets funded in an NDIS plan, and we'll look at the impact and the opportunities of the business model. We'll also talk about governing in the NDIS and some of the challenges for you as a governing body. So the NDIS was introduced after years of discussion about the need for major reforms of disability supports in Australia. In 2008, Australia ratified the UN Convention on the Rights of Persons with Disabilities. It's the first human rights treaty of the 21st century, and it moves away from seeing people with a disability as objects of charity, medical treatment and social protection, and regards them instead as people with equal human rights. People with disabilities are able to make decisions for their own lives and can be active members of society. As a response, Australia introduced the National Disability Strategy in 2010 to develop a strategy guide for the development of policies across all states and territories. The strategy aims at creating an inclusive society that removes barriers and enables people with disability to fulfil their potential as equal citizens in Australia. Inclusion means that people with a disability can participate in everyday activities and have the same opportunities as everybody else. In an inclusive society, we respect differences and we accept people for who they are. A public inquiry by the Productivity Commission into long-term disability care and supports in 2011 found that Australia's disability support system was underfunded, unfair, fragmented and inefficient, and gave people with disability little choice and no certainty of access to appropriate supports. Most Australians with a disability were living below the poverty line. The Commission suggested the implementation of an insurance scheme to support the entire Australian population to minimise the impacts of disability. The provide information and referral services to anyone with a disability, and to provide long-term care and support with people with significant and ongoing disability. So the NDIS Act 2013 was introduced in March 2013 to replace the previous system of disability care and support. The legislation established the National Disability Insurance Agency, the NDIA. The NDIA offers strategic coordination and referral services to anybody with a disability. This work is now funded through the Information Linkage and Capacity Building Programme. The NDIA also manages and administers the National Disability Insurance Scheme, the NDIS, which offers the individualised support for people with permanent and significant disability. Another agency, the NDIS Quality and Safeguards Commission, also referred to as the NDIS Commission, is responsible for registration and regulation of providers, for compliance with NDIS practice standards and the NDIS Code of Conduct, for complaints and reportable incidents, and for use of restricted practices, and for worker screening. So the NDIS is part of an overall ecosystem that supports the 4.3 million Australians that live with a disability, and that's 1 in 5 of us. So people with a disability get support from family, friends and the community, and from mainstream systems such as health, child protection and education. The NDIS doesn't replace any of these mainstream services, and actually only 460,000 of the 4.3 million Australians with a disability are expected to get an NDIS plan. Partners in the community are agencies engaged by the NDIA, their local area coordinators, also known as LACs, and early childhood early intervention partners that help people with disability to access any services and conduct most of the planning meetings for individual NDIS plans. And as we mentioned in the previous slide, the information linkages and capacity building work is essentially supporting disability inclusion. So people with a permanent and significant disability can access reasonable and necessary supports over their lifetime via the NDIS. Individuals get funding in their NDIS plan, and they have choice and control on spending these funds. People with an NDIS plan can decide over their services and what should be delivered, how much, when and by who. Community inclusion is now an integral element in supporting people with a disability. So who can get access to the NDIS? So any Australian citizen or permanent resident or person that meets the specific residency requirements can access the NDIS if they can prove that they have a permanent and significant disability. It's an insurance scheme for all Australians under the age of 65. Children under the age of 7 can get supports under the Early Childhood Early Intervention Programme. To access the scheme, the NDIS will need to be satisfied that a person's impairment is serious and permanent. The person needs to demonstrate that their disability substantially reduces their functional capacity to undertake communication, social interaction, learning, mobility, self-care or self-management. The NDIS requires a functional assessment of what the person can and cannot do, and this is also used to identify an individual's support requirements and plan funding. So it's important to realise that the diagnosis itself does not determine the funding amount, it's the person's functional capabilities and capacities. So what is funded in the NDIS plan? So we referenced earlier this concept of reasonable and necessary supports. Under the NDIS Act Section 34, the supports need to be related to a participant's disability and not include day-to-day living costs. Food, for example, isn't funded by the NDIS, so that's just part of your day-to-day living cost. But if you need help with food preparation and delivery, that could be funded if you're not able to shop and cook for yourself. The funding needs to represent value for money and to assist the person to pursue their goals. So if your goal is to spend more time with your family at the beach, it may be that you can get funding for a special beach wheelchair. But if you're living 800 kilometres from the beach, that's unlikely to be considered reasonable or necessary because clearly it's not part of your day-to-day activities and community engagement. So the NDIS plan funding should assist you to increase participation in social and economic activities. Supports need to be effective and beneficial, and they also take informal supports into consideration. So this means parents with a child with a disability may not receive sufficient funding to care for children with complex needs, so childcare is considered to be the responsibility of parents. Also, the NDIS needs to be the most appropriate funding body and not the responsibility, the supports are not the responsibility of the education or healthcare sector. So what determines the funding in the NDIS plan? So variables such as the age and stage of a person's life, their primary disability, their functional impairment, their living situation, and their personal goals all contribute to that funding formula. The NDIS might fund personal goals such as the development of independent living skills, participation in art, driving a car, losing weight, learning new skills, getting work, moving out of home. There's a range of goals that can be funded under the NDIS. So altogether, that's a complex formula with many variables, and that results in the funding of supports. So it does mean that people with the same disability and support needs can receive very different funding packages, and funding packages can vary from one year to the next as people's life circumstances and goals change. So for you, governing an organisation working in the NDIS, what does doing business in this market look like? So this is a useful model for governing bodies to understand in terms of this focus on person-centred care, which really follows from the UN Convention, and it's about service delivery being informed by human rights, choice and control. So if you were involved in providing services prior to the NDIS, this is a mindset shift from a welfare model. And for all providers, it's this person-centred values and thinking that you need to bring to the board and to your organisation. So under this model, we move from talking about the person and planning for them to talking and planning with them. The focus is on strengths, abilities and skills rather than on labels, diagnosis and deficits. And it's about finding solutions that work for people, preferably in the community, and doing things in a way that work for them rather than that work for the organisation. And family and community are seen as partners. So this results in individualised customer-focused supports where the person with a disability is at the centre of service delivery. So it means that your people that are involved in delivering supports need to genuinely care about the person they support, truly listen to them, find solutions that work for them and build on their strengths, abilities and skills. And the people with disabilities are subjects with rights and capable of making their own decisions. So those NDIS supports are not service or system centred, but they're actually considering the individual's goals and needs. And under this NDIS business model, the person with the NDIS is the plan is the purchase of services. So it moves very much from block funded contracts to individualised pay as you go in arrears type funding. The person can choose their provider and depending on the total funding amount in their plan can purchase as many services as they need up to that plan limits. However, they can't spend more than the amount provided for in the plan. And so it means that from your perspective, you may be delivering a variable volume of service, you need to provide quotes for the cost of service in advance, and you need to agree the terms and conditions providing those services with the participant. And they'll pay you most likely on an hourly basis and in arrears, depending on the service. So in terms of payment, how much does the service cost? The NDIS price guide sets the terms and conditions for NDIS service provision, such as cancellation rules and which activities the provider can charge for or not. For example, there are some services where you can charge travel time on non-face-to-face activities, but not on all. The NDIS support catalogue is actually the price list, and it sets the price limits for support categories such as personal care, community access, domestic assistant and professional services, and helps to clarify what can be claimed. Most prices are listed on hourly service provision, and as a provider you need to really understand and apply these rules. You're also obliged to comply with Australian consumer law and the Competition and Consumer Act. A completely new format of the NDIS price guide and the NDIS support catalogue were introduced on the 1st of July with further updates since. You can find a summary of all recent price changes on the CBB website in our forward tab. Since the NDIS started, the prices have seen an adjustment of about 70% increase, and in the last year or so, prices have increased between 20 and 27% for standard reports, and services in rural areas increased by 40%, and for remote service provision by 50%. So some services are more profitable than others, and remote service providers do still struggle to generate enough income even with the increased prices. So as you can see, the price guide does change quite a bit, so it's really important that you stay on top of that as a provider. So if we move on to looking a bit more at the NDIS market, the NDS, the National Disability Services, which is the peak body for not-for-profit disability service providers, produces an annual State of the Disability Sector report, and the latest one we have available is from 2019. In this survey of disability service providers, 11% responded that they were considering getting out of the disability sector, with 25% saying that they would stay but weren't expecting to grow. When asked if providers were intending to change their service volume in the next 12 months, between 50 to 70% of providers said that they plan to grow services depending on the service type. Clearly, this was all pre-COVID, and the actual results and what people were able to do would have been quite different, but it shows that there was an optimism for growth prior to the COVID crisis. The biggest challenges for providers are the constant changes to the system, and about 53% of providers expressed that they were worried about their ability to adjust to ongoing changes. Most providers responded that they get more service requests than they can deliver, which shows there's currently not enough service available, so there's opportunity for growth. The NDIS produces a quarterly report every year for the Coalition of Australian Governments, and quarterly report every quarter, and the most recent one was released for up to the quarter up to June 2020. So according to this data, there was a moderate growth of providers of 4% over the previous quarter, and as of June 2020, there were 14,882 registered NDIS providers. However, only 60% of those were active providers in that last quarter. So 38% registered but weren't providing services. Payments for NDIS supports are also reported in the quarterly report, and those have grown 61% over the past year, with $5 billion paid for supports in the last quarter to June 2020. So it's worth considering that growth up to June 2020 included the period of national lockdowns for COVID-19. The growth is due to more participants joining the scheme, and for existing participants, as they learn to express their needs, they may have higher plan values and receive more funding in consecutive plans, or use more of their plan, and we'll talk more about that. So this issue about plan use, the latest NDIS report shows how much of the plan budget is actually being spent. So we know that $5 billion was spent, but looking at national figures, on average, only 70% of plan funding is spent. So it's a lot of underutilised funding. Plan utilisation is higher for people who live in group homes and receive supported independent living, also known as SIL funding. Plan utilisation also increases the longer someone has a plan. So you can see here that only 54% of the first plan was spent, compared to 79% of the fifth plan. So overall, we can see that 30% of plan budgets are not being spent. So the combination of quarter-by-quarter growth in supports and continued under-plan utilisation means there's opportunities for providers to increase their business. This picture shows plan utilisation by remoteness, with the national average on plan utilisation in remote areas being at 58%, and in very remote areas it's only down to 36% of funds being spent. So why does this happen? There's a persistent problem in the NDIS in that services are not available to everybody in all communities. So people in rural and remote areas often have little option of where to access services. So there's an undersupply in some areas. The NDIS is also difficult to navigate, and often people don't understand how and where to spend their plan funding. So only 40% of people that have an NDIS plan actually get assistance by having funding for support coordination, which is essentially a funded support that helps people with an NDIS plan to find and connect with services. So that leaves 60% of people who are finding their own connections to services. The NDIS is difficult to navigate for providers too, and we've noticed when working with providers that many do not charge all of the fees that they're entitled to charge for. So that leads to funding gaps for providers and again for low plan utilisation. We also don't think that 100% plan utilisation will be normal. Life changes for people, their circumstances and goals can change, personal living circumstances and things like that. So it may be that what they start out with intending to do with their plan is not actually what happens by the end of the year or the period of their plan. So we'll talk a bit about registered and unregistered providers. So as a provider, you have the option to register with the NDIS Commission or to provide services as an unregistered provider. So obviously a key decision for you is whether you should register or not. And this table compares the requirements of registered and unregistered providers. So both registered and unregistered providers are obliged to provide services that are safe and protect people from harm. So that means you need to comply with the Code of Conduct, you need to screen workers, and you need to have a complaints management system in place. The big difference between registered and unregistered providers is that a registered provider can provide services to anybody with an NDIS plan, and we'll talk a bit about the different types of plan management in a minute, whereas an unregistered provider can only provide services to people that are plan managed or self-managed. In order to register, you need to undergo a registration process and regular audits, and that involves additional compliance requirements, which include having quality systems in place, and you need to implement those throughout your organisation. There are some particular services where the provider must be registered. So that includes plan management, specialist disability accommodation, behaviour support, and if you're implementing behaviour support plans or using restrictive practices. So there's higher risk activities. So looking at the different types of plan management, there are 3 different ways for an NDIS participant to manage their plan budget and pay a provider for their services. So there could be NDIA or agency managed, plan managed and self-managed. And participants should be asked at their planning meeting how they want their money managed, and they're free to choose these 3 options. If the money is NDIA managed, the person can only use registered providers, and the provider can only charge up to the maximum price set in the NDIS price guide and support catalogue. In this case, providers claim a payment directly from the NDIA after the service has been provided. Any NDIS participant can request plan management, and with some exceptions it will be approved. In this case, the participant engages a third-party plan manager who has to themselves be registered with the NDIS Commission as a plan manager. The NDIS will provide separate funding in the plan to pay for the service of the plan manager. And the provider invoices the services, and the plan manager will pay the provider after claiming the money from the NDIA. The advantage of this is that the participant can spend their funds with registered and unregistered providers, but the price for the service must still be in line with the NDIS price guide and support catalogue. Self-management only tends to be approved for people who can confidently navigate the system and are not at personal and financial risk. So if a person is self-managing their NDIS funds, they're free to engage any provider, registered or not, and they can negotiate their own prices. The person pays the provider directly and then claims the money back from the NDIA. So many people actually choose a combination of how the money is managed in their plan. So this just shows you how NDIS plans are managed by the financial value of plans. So you can see there's an increasing value of plans that are self-managed. So those are the ones that are coloured in the lilac-y colour, so 12% as of the last quarter of June 2020, and also those that are plan managed. So sorry, plan managed is the dark green at 30% and self-managed is the light colour at 12%. So a total of 42% of total plan value is plan managed and self-managed, meaning it can be spent with unregistered providers. It's mainly the plans of young people that are self-managed, indicating that many parents manage the NDIS funding on behalf of their children, and adults are more likely to have a plan manager. So the market is still growing, and that underutilisation of NDIS plans means that demand is currently greater than supply. So what's in the future for providers and people with NDIS plans? This is our crystal ball moment. So the NDIS Act is currently under review, and in January 2020, the Tune report made 29 recommendations aimed at improving the NDIS for people with a disability, their families, carers and providers. The recommendations included more clarity around what is reasonable and necessary and what remains the responsibility of other systems. The report also recommends reducing the administrative red tape and more support for people with disability to navigate the scheme. The NDIS announced that in 2020, people will be able to view their draft NDIS plan. This would allow people to review and amend their personal details, their goals, living arrangements and supports prior to plan finalisation. This hasn't been introduced yet. Often people with disabilities receive plans with insufficient funding and then enter a bureaucratic battle with the NDIS to argue for adequate funds. The NDIS Minister, Stuart Robert, has said that in future planning might be joined between the local area coordinator and the NDIA planner. We don't yet know how this will work in practice, but it could lead to better plans and more accurately reflect people's support needs. In July, the NDIA announced improvements for people living in remote areas. The Community Connectors Programme, or NCCP, will support people with disability from hard-to-reach communities and disadvantaged population groups to access and navigate the NDIS. The NCCP will be rolled out over 2 years and will build on existing agency connector programmes. The NCCP will focus on supporting targeted communities such as Aboriginal and Torres Strait Islander and people from culturally and linguistically diverse communities, participants with ageing parents, carers of children with disability, and people experiencing psychosocial disabilities. And it will support them to navigate the NDIS and to get the services they need. The NDIS has also acknowledged that this one-size-fits-all approach doesn't work, given the diversity of participants in the scheme, and has started pilot projects in all jurisdictions to address market gaps relating to geographic locations, particular cohorts of participants, and disability types. In response to the COVID-19 crisis, the NDIS did offer some additional support for providers. For example, registered providers could access a 1-month prepayment for services to ensure cash flow within the business. That was only available to registered providers and highlights that there are some advantages to registration beyond being able to provide services to the full market. The National Disability Insurance Scheme is projected to continue to grow and reach 500,000 people with a disability in the next 3 to 4 years, and it's forecast to cost 1.2% of GDP. So this further growth provides opportunities for NDIS providers. So assuming that you are or you decide to offer NDIS services, what do you need to be aware of as a governing body? So we've talked about some of the conditions of registration. Now, compliance with the Code of Conduct, with complaints management, with worker screening are all requirements of all providers. So we're going to talk through some of the specific requirements in relation to registration. So you will need to ensure, and again this applies to all providers, that workers are screened through the national screening process. And for those of you that are providing behaviour supports, you're required to be registered, and that includes reporting restrictive practices to the NDIS Commission. The NDIS Commission monitors NDIS providers for compliance with the conditions of registration and has the power to suspend, vary or revoke registration. As a registered provider, you need to have audits with an approved quality auditor, and these occur at registration and then also at renewals and recertification. So 6 months before the expiry of your registration, which is normally for a 3-year period, you'll need to have a further audit. There are 2 different routes to registration, a verification route, which is slightly more light touch, and a certification route, which is more intensive and applies to more personal complex services. For providers that are registered through the certification route, you're also required to have an interim audit during the 3-year registration period. So if you do choose to register, one of the things that the NDIS Quality and Safeguards Commission will look at is the suitability of your organisation and your key personnel through the suitability assessment. So it'll assess your application either to register or to recertify with respect to the suitability of your organisation and key personnel, and that includes individuals who hold key executive, management or operational positions, such as directors, managers, board members and a chief executive. And the suitability assessment looks at whether you or your key personnel, you as a provider or your key personnel, have previously been registered as an NDIS provider, so looking at previous NDIS experience, but also look at things like whether you have a banning order in place, any past convictions, whether you've been insolvent under administration, had any adverse findings or enforcement action taken by relevant authorities, been the subject of findings or judgment in relation to fraud, misrepresentation or dishonesty, or being disqualified from managing corporations. The NDIS Code of Conduct applies to all providers and sets the expectations for appropriate and ethical conduct in delivery of supports and services. It's a human rights-based approach, and in providing supports or services to people with a disability, people covered by the Code of Conduct must act with respect for the individual rights to freedom of expression, self-determination and decision-making in accordance with applicable laws and conventions. Must respect the privacy of people with disability and provide supports and services in a safe and competent manner with care and skill, acting with integrity, honesty and transparency. They must ensure quality and safety and take all reasonable steps to prevent and respond to all forms of violence against and exploitation, neglect and abuse of people with disability. Must take all reasonable steps to prevent and respond to sexual misconduct as well. The Commission has developed individual guidelines for workers and providers to help you understand the Code of Conduct requirements. So worker screening is required for key personnel roles where normal duties include direct delivery of specified supports or specified services, roles where normal duties are likely to require more than incidental contact for people with disability, and contact includes physical contact, face-to-face contact, oral communication, written communication, and electronic communication. There are interim arrangements in place currently by state or territory, but the NDIS Commission is moving towards a national transportable check. So if you're screened in one jurisdiction, you can take the screening with you to another. Then we have the NDIS standards model. So the NDIS practice standards consists of a series of high-level participant-focused outcomes, each one of which is underpinned by a number of quality indicators that auditors will use to assess your compliance with the NDIS practice standards. So there's a range of modules around the NDIS practice standards, and the core module covers 4 quality standard areas. So the rights and responsibilities of providers, so rights, participants and responsibilities for providers, governance and operational management for providers, the delivery of supports and the environment in which supports are delivered. So altogether there's 22 outcomes and 87 quality indicators that will apply to registered providers. To give you an example of the some of these outcomes and indicators, the core module for governance and operational management covers the following standard areas. So governance and operational management itself, risk management, quality management, information management, feedback and complaints, incident management, HR and continuity of supports. And it's important for you as a governing body to be across these. So to give you an example of one of the outcomes under these standards, so under governance and operational management, each participant's support is overseen by robust governance and operational management systems which are relevant, proportionate to the size and scale of the provider and the scope and complexity of supports provided. And this concept of proportionality is common across the standards and essentially means that depending on the risk exposure of the services that you're providing and the size and scale of the organisation, the standard that you're expected to comply with will be greater or lesser. Indicators for the areas that auditors will look for when certifying or recertifying your organisation. So one of the examples of indicators here is that opportunities are provided by the governing body for people with a disability to contribute to the governance of the organisation and to input into the development of organisational policy and processes. Another one is a defined structure to meet governing body's financial, legislative, regulatory and contractual responsibilities and to monitor and respond to quality and safeguarding matters. The skills and knowledge required for the governing body to govern effectively identified and relevant training are undertaken. So expectations there around how you govern, how you engage people with disability in your governance processes, the structures that you have in place and the skills, knowledge and experience that you have in order to govern your organisation effectively. A further indicator looks at ensuring the governing body ensures that strategic and business planning considers legislative requirements, organisational risks, requirements relating to operating under the NDIS, participants and workers' needs, and the wider organisational environment, and that performance of management, including resource responses to individual issues, is monitored by the governing body to drive continuous improvement. So that expectation that you're constantly looking to improve the quality of your services. A further indicator looks at providers being managed by suitably qualified or experienced persons with clearly defined authority, responsibility, and accountability for provision of supports, and that you have a documented system of delegated responsibility and authority within the organisation. That you have perceived and actual conflicts of interest are proactively managed and documented. So again, governance issues and issues around how you engage as a governing body with your senior team and with the business. So that's given you an example of some of the standards and indicators, and really it is worth looking through those in more detail and making sure that you understand them as a governing body. So some of the issues that you might need to consider when you're thinking about whether you do want to provide or grow NDIS services. So in particular, thinking about how does NDIS provision align with your mission, vision and strategy, and the people that you want to support. So are the people that you support currently getting the NDIS services they're entitled to, and do they have access to the services that they need? So for example, some of the organisations that we've worked with have identified that their existing client group do have disabilities, but they're not necessarily accessing all of the NDIS supports that they might be entitled to. So have looked at establishing new services within their current portfolio that provide NDIS services to their existing client group. Depending on the services that you offer, you can choose whether or not to register, but bear in mind that registering means that you will only provide the decision not to register mean you can only provide services to plan and self-managed participants. The most vulnerable people and those with the most complex needs are more likely to be agency managed, and they can only access registered providers. So for values-based providers, and particularly for not-for-profits, deciding not to register might not sit very easily with your values, because it essentially means that you can't provide service to those that are most vulnerable and have the most complex needs. In terms of your governing body, it's also worth looking at how you're set up to govern in the NDIS market. So as we saw, that the indicators that are expected under the NDIS standards include looking at your skills and your knowledge and your behaviours in terms of how you govern the organisation. So think about whether you have a genuinely skills-based board. We're seeing lots of boards looking to ensure they have the right skills on board, but also that they engage in ongoing learning and training for their board members, because you can't be complacent about your skill set in this market. And think about as well whether your board have the experience and capability to provide professional support to your CEO or senior staff. So are you able to really mentor and coach your staff through some of the challenges of navigating the NDIS market? What's your understanding like of the NDIS market? And think beyond the headlines and personal experience. So do you really truly understand the market in all its aspects that are relevant to your organisation, or you're just going on your individual interactions with it? Think about how you might need to let go of past practice, particularly if you've been in the sector for a long time and you've got more of that welfare mindset. You might need to move to more of a human rights mindset to govern in a new environment. And be prepared to make difficult decisions. You will need to balance some commercial realities with some values-based governance. And so, yeah, following through on hard decisions is going to be essential. And also ensure that you are prepared to undergo suitability assessment and your worker screening, because as board members you're expected to undergo those as well. So as a governing body, you need to be across all of these quality and safeguards issues and in that headset of choice and control. So make sure you're taking a rights-based approach, and that the rights of and the voice of participant is informing your decision making. So in particular, make sure you've got oversight of quality assurance, that you're monitoring incidents and complaints, and you're undertaking regular internal audits. And look at your continuous improvement programme. What are you doing to make sure you're always getting better? So finally, think about whether you have the right leadership and workforce in place. So Does your team have the skills and experience, the understanding of commercial realities of operating in the NDIS, whilst also being able to offer person-centred, high-quality supports? Do they have the capacity to provide safe services that keep participants safe from harm? And do they have the operational skills needed to manage the services, particularly given some of the challenges that have happened in COVID environment? Think also about your senior employees and your key operational personnel. So they're also subject to suitability assessment and worker screening. And think about the challenges of the labour market. So it can be difficult to recruit and retain the right staff, particularly in rural and regional areas. Also prepare for ongoing organisational learning, skill development and employee engagement. It's likely as well in the course of working in the NDIS that you're going to need to invest. Certainly most of the established providers that we've been working with have been looking at improving systems and marketing, ensuring that they have IT requirements in place for management and reporting, and that they are able to operate in a competitive market through a proactive marketing strategy. Remember that choice and control means that your service provision isn't static, so participants may stick with what they know for their first plans, but people will also look for different solutions. Underutilisation is partly because the service that people want isn't there. So there's an opportunity for you to innovate, and at least you must be looking at continuous improvement, because there is a risk that if you don't do that, your participants might go elsewhere. In terms of this individualised service delivery and payment model, you also need to ensure that your financial information is giving you the data you need around trends in cash flow. So if you're being paid in arrears, or you will be being paid in arrears, and your payments will vary from day to day, month to month, because of the choice and control model, you really need to be on top of monitoring really current information about your finances. So you need good data, reporting and metrics for your financial and non-financial information in order to inform your understanding of the risk of the business and how you're faring from a quality and sustainability of service perspective. So that concludes this particular webinar. In terms of what's coming up, we have a Q&A session. So each of our webinars is followed by a Q&A session to give you the opportunity to ask questions. And we'll encourage you to submit questions at any time prior to the Q&A via the Facebook group or via email. You can join our Facebook group if you haven't done that yet, and you can send emails to us at ndis@cbb.com.au. The Q&A session for this webinar will be on the 10th of November. Our next webinar will look at strategy, risk and impact from a governance perspective, and will be available from the 17th of November. Thank you for watching, and goodbye for now.